From the studios of KENW on the campus of Eastern New Mexico University, it's You Should Know, featuring the people and events of Eastern New Mexico and West Texas.
Welcome to You Should Know. I'm your host, Evelyn Ledbetter, and today I have the pleasure of having a couple of gentlemen come back in. They had so much information. Dave Rogers and Phil Huston are with LifeHouse in Carlsbad.
Mm-hmm.
So thanks for being here today.
Thanks for having us back. It's
For sure. So tell me just a real quick synopsis of your background a little bit.
Sure. I'm Phil Huston. I'm the executive director and founder of LifeHouse. We started LifeHouse in 2016, and I started full-time with LifeHouse in 2019 after a career as a pastor for several years there in Carlsbad.
And Dave, how about you?
I've been with LifeHouse since 2021, and I've been with the rehab through the Via de Esperanza since 2015. And I'm also a pastor. I have a small church in Carlsbad that I still continue to pastor, but my real paying job is to run the residential treatment that is the Via de Esperanza and the Avalon program under the LifeHouse umbrella.
Okay, and you're actually the executive director of the facility, right, Phil?
That's correct.
So tell me a little bit of what LifeHouse is, and then let's go over some of the services that are provided, if you'll do that.
Yeah, we provide a lot of things for substance use and mental health treatment. Through the years, we've just kept adding things that the community needs to try to meet folks' needs. So on the substance use side, we do detox, rehab, sober living, and some intensive outpatient services, so a variety of levels of care. And then on the mental health side, we have a whole range of counseling services. We have a community response team that does crisis response anywhere in Eddy County. We have counselors that do individual and group therapy. We are about to launch our assertive community treatment program, which will help people with high psychiatric needs. We have some outpatient case management services and programs for families with individuals with substance use problems. So pretty broad range.
Right.
And we also, not only do people come to us, but we provide services in the Eddy County Detention Center, Carlsbad High School, and a few other places.
That's really nice. I mean, if you get into the high schools and start educating early, that has to make a difference. And that's a really neat deal. I mean, going to the people that are incarcerated and getting started right there. Is that something you work with, Dave, so much, or probably not?
No, I receive them after they are released from the Eddy County Detention Center.
Okay.
The peer support workers that we have going into the jail, they are peer support workers. They are in recovery themselves and have gone through the training, not only to be able to do the security and to get into the jail, but to really work one-on-one with those individuals or do group sessions with them. And that is a really good starting place so that rather than just sitting in the jail, they actually get some comprehensive, meaningful drug rehabilitation education. And many of those clients end up then coming into my program once they are released.
Well, they have a lot of time to think and process when they are incarcerated, and it's not a fun place, so let's figure out how to make a change and much more open. If somebody out there right now is needing rehab, and do you take people from all over the state?
We do.
And how do they contact you, Phil?
So they can call us, 575-725-5552. They can go to our website, lifehousecarlsbad.com. They can actually put in the referral right on the website. And then the process would be that we would schedule a screening to see what program and services they qualify for. And then if it is the rehab or detox or sober living, something like that, we would schedule a date for them to move in. If it's one of the outpatient services, we'd give them their first appointment. One of the exciting things, we're working to become a certified community behavioral health center. And part of that means that our access requirements have increased. And so everyone that calls for outpatient services will get their screening and their initial assessment and diagnosis done within 10 days of when they call.
So tell me a little bit about this. It's the acronym CCBHC.
Yep.
But Certified Community Behavioral Health Clinic. Tell me what that is.
So it's a federally designated service type, and it really is about having an array of outpatient services to be able to do community-based mental health and really meet the needs of the community. So you start by doing a community needs assessment that helps you identify what the needs are and what areas are the biggest need. And then there's 9 core services that you have to provide that include a lot of screening, assessment, and treatment on the outpatient level, but also crisis services, outpatient substance use services, peer support services, veteran services, to make sure that you can meet kind of all those general needs.
Right.
And then the idea is that those all work together, and you work together with the other agencies in the community to have seamless referrals, have better access levels and access requirements. And it really is a great way to serve the community, and that's why we've pursued that designation. We'll be the first rural CCBHC in New Mexico.
So that process, I'm going to guess this didn't come at a cheap price tag at all.
We were very fortunate to get some support both from federal grants through Senator Heinrich's office and state grants through the Rural Healthcare Delivery Fund. And then we've also got some county support through the opioid settlement money. And so through all of those grants, we've been able to bring up these various services and hire some new folks in those areas and to expand our current services to meet all those requirements and standards that the CCBHC requires.
And the cost, I mean, can you tell me, and like overall budget wise, yearly, how many staff do you have?
So right now we have 140 staff.
Wow. Full time?
No, that includes part-time,
Okay.
but some, by and large, those are full-time. Next year, we plan to do about $12 million just in services to the community.
So that's huge. I mean, it's overwhelming to think of raising millions of dollars. And is part of the funding through matching? Like you have to contribute so much yourself to get that matching
none
grant?
of the grants that we got for CCBHC were matching grants, but we do rely on the community and our other fundraising efforts to be able to expand. And really the biggest project we've done through that is our sober living expansion, where next year we'll be opening 2 more sober living homes that are getting far along in the construction process right now. So we've had a lot of big projects and had to bring in a lot of funding to do it, but we've got great support in our community and from our municipal partners in Eddy County, and then from the state and federal government as well.
Dave, are you seeing a difference of can you give me like a kind of like a window view of the patients that you work with in the detox part? Is it any one certain group, or is it?
It's across the board. And I have to tell you, this is really why I get out of bed in the morning, because I have people that I saw come into the detox, and they were literally at the end of their life, the end of their rope. Addiction, whatever, has just destroyed, taken everything away from them. And I've watched them work through the rehab program and go on into the sober living program and work really hard to put their life back together. And many of them have subsequently returned to work for me.
Oh,
and
that's perfect.
A lot of our staff are themselves in recovery. Many of those, after doing their 3 years of sobriety, have gone on to take the peer support worker training and are now certified as a peer support worker. And when a person completes my program, frequently what I will tell them is, I don't ever want to see you back here again unless you're working for me. And it is one of the neat things that we offer, because for obvious reasons, we are a safe and sober workplace. And as anybody that works out in the community knows, there are very few truly drug-free and working environments. And that doesn't mean that drugs are in every office, but they're there. But we are such a strong sobriety focused environment that people who work for us continue to have that sobriety support and that structure and that environment, and they get to see other people where they used to be come through the program, and it is so beautifully hopeful. And I see that, and I see the people that I've seen at their worst. I see them now thriving, and it just, wow,
Well,
that's what's exciting to me.
I think for me, we form friendships and bonds with people that have something in common.
Hmm.
And for you to have somebody that's worked these steps, that's huge.
Hmm.
And you're both pastors, so there's got to be that element in recovery. A lot of the time is faith-based as well.
Hmm.
And one of the things that we think is important, substance use isn't an isolated issue. It's something that takes over your whole life in a lot of different ways, your physical, mental, and spiritual health. And so the solution and the treatment to that also has to be holistic and address your physical, mental, and spiritual health. And so we think all of those elements are important when it comes to helping folks heal and find the
Mhm.
life that they really were made to have.
Well, and then the financial part of that, there's some sliding scales and also possibly some help that people might could get financially to get involved or get into one of
We do
the treatment
everything we
centers.
can to keep finances from being an obstacle for folks to get the help that they need.
Right.
So we have a variety of grant programs and other funding sources and ways that we help people get tied into funding sources, and then our sliding scale, so that money shouldn't be the reason that
Mhm.
people don't get treatment.
Are you seeing it more so in insurance now that insurance companies are covering some behavioral health treatment more than they did in the past?
So a few years ago, there was some legislation passed in the state of New Mexico that eliminated copays for many folks around
Mhm.
substance use and mental health. And so we've seen that coverage be improved. But I will say one of the biggest struggles we have every day is fighting with insurance companies about what they're willing to pay for
Or
or
not?
creating obstacles for folks getting the help that they need. So there's still a long way to go in terms of getting folks that have insurance coverage to get the help they need timely and well covered.
Do you find that correlation really often of someone that has some mental health issues, that addiction is something very common to fall into?
Oh,
Or
absolutely.
that's they prop that up?
It's a cycle, and sometimes people use illicit drugs to mask an undiagnosed or underlying mental health condition. And then when they detox, that old mental health problem begins to manifest. And we have people that become uh, addicted as a part of their mental health. And so we do a lot of balancing. We're not a mental health facility, but we do have issues where mental health becomes a problem. And most of the time, we're able to manage it. If it becomes a psychotic episode, we have
Right,
other places where we can refer people out. That's very rare, but it does happen.
right. You know what amazes me is, like, I know trying to just leave your life for 30 days, if you've got children or jobs and just saying, "I'm gonna be gone for 30 days," guess what? When you have the rehab that's available or the treatment when it's outpatient, do you have more people that go through an inpatient or an outpatient treatment?
We do a lot of both.
Okay.
And we try to have as many options as possible to meet people with where they're at.
Mhm.
So there's a program called intensive outpatient treatment, and it's typically 9 hours a week of group therapy supported with some individual work. And that can be done entirely outpatient. We even have it where you can do it thoroughly through telehealth.
Wow.
And so you don't even have to physically come to the facility. We have groups 3 nights a week for 3 hours. We have a telehealth and an in-person. We have two varieties of it. And usually we have a group of 10 to 15 people at a
Wow.
time doing those two groups as well. And that's the highest level of care that we offer that's not residential. But a lot of folks participate in that way, particularly if, because of life
Sure.
circumstances, that it's hard for them to take the time out for rehab. We also, though, have our program for women with children where they can bring their kids with them.
Oh, wow.
And so we hope that that eliminates an obstacle for many women that, it's really hard to make that decision to
Sure.
leave your kid behind to go to rehab. And so that gives them the possibility of bringing them with them and removing that obstacle.
Another way to reach people that might not have that ability otherwise.
We also have that on the sober living side. One of our sober houses allows women to live with their children. And the children will enroll in the local Carlsbad schools. Mom gets a job, she goes through the program. And that really helps keep families intact while mom deals with the struggles of recovery.
Yeah, wow. And so then some of the volunteers, do they come in and help with the childcare or just different cooking and things
We
within
have staff that
staff that do
provides the
all of that?
child care. Yeah.
Okay. So another obstacle down because again, I'm thinking you're broke, you're addicted, and how do I even get started on turning my life around? It would be overwhelming. I mean, just I can't even imagine.
It starts by picking up the phone or going online and reaching out to us.
Well, you said that Eddy County had been very supportive. If someone wanted to donate or get involved, is there a way for them? How do they go about that?
Yeah, absolutely. The best way to find us is through our website or through Facebook, and there's
Okay.
ways to ask for more information. There's ways to make donations there. You can see information about our upcoming fundraising events and our upcoming efforts, and that's probably the best way to get in touch. We'd love to talk with anybody that's interested in helping us out.
And any financial donations, we're a 501c3, so you can
Donate.
claim them on your taxes.
Yep.
Very nice. And you know that money's going to go. And I think a lot of the problems in our country, this is a piece of there's a lot of different pieces of it, but that's one to help people.
Yeah, absolutely. If you look at a lot of the problems that we face, it's driven in a lot of ways by substance use and mental health. I mean, if you think about crime, if you look at the folks that are incarcerated, by and large, there's a substance use or mental health problem there. If you look at CYFD, which has been a big issue in New Mexico, the families that often have gotten involved with CYFD that are in the midst of those investigations and cases, a lot of times substance use and mental health are problems in it. If you look at struggles with workforce and productivity in the workplace, substance use and mental health often have a role to play in that as well. And so it's really an issue that if we can effectively address, it should help in a lot of other areas. And so it's
Sure.
important that we understand that the investment in substance use and mental health treatment isn't just for that problem, but to help a lot of
For
other
everything.
things as well.
Well, and there's a lot of shame to admitting that you have an addiction. You don't want to admit that, or even more so to let people outside of your little small group know you've got something going on.
One of the things that I do every day with my clients, and I'm very adamant about this, is to remind them that as far as me and my staff are concerned, as far as I am concerned, they are not their past. They are beautiful human beings. They have had circumstances.
Right.
They've made mistakes. They've got criminal charges. They've got criminal records. They've got time in prison. So what? That's gone.
It's a new
You
day.
are here today. You are a beautiful human being. You deserve to live the life that you want. And this is a safe place for you to do the hard work of becoming the person that you know you want to be. And you deserve to be treated with the respect and the dignity of being the human being that you know you can be. So many of the folks, you talk about the stigma, they've been stigmatized so much. So many of them are generational. One of my employees was born in the women's prison because her mom was locked up for drug charges,
And that cycle continues.
and that cycle continues. And but to overcome that stigma and to treat them with the dignity and the grace and the humanity,
Right.
I think that's where our pastors' hearts really come in because we're not looking down on them. We're treating them with the dignity that in many cases they've been denied.
I know for me, there's a plenty in my closet that I don't want to show to everybody. And I know I'm not going to get on somebody else because my closet isn't clean either.
Well, and I think it's important that we talk about it. We talk about struggles with mental health and with substance use because a lot of that shame just comes from not realizing that so many people have these struggles. So the most recent data suggests that 1 in 7 adults, or really people over the age of 12 in the United States, have a substance use disorder diagnosable. And so that's way more prevalent than I think we would guess that it is, but it's really because we just don't talk about it. And it's even more prevalent to have to have a mental health need. Statistically, 1 in 2 people sometime in their life will need a counselor. And so it's really something that no one should have any shame in.
Right.
I've talked with hundreds of our clients, gotten to know their stories, and they're not that different from any of us.
Sure.
It's just they've faced trauma a lot of the time. They've had something terrible happen, or they've never learned. They've not been in a place to be successful. And, you know, if you look at their lives, just one or two things that sent them down this path could have been any of us.
Sure.
And so they're not different from us. They're not a different type of person than we are. They're us. And it's really about helping them become whole people and unlock their potential. And we all benefit from that.
Right. Well, and you know, I know you guys were recognized in Newsweek, which is huge. As one of the, Dave, you told me this, the stats on what they said.
Well, we're number 2 addiction recovery center in the Western region, and number 1 in the state of New Mexico, and that is as according to Newsweek magazine. We're pretty happy about that.
That's a pretty good kudos to you guys. What do you think it is? I mean, all counties and all states, and obviously New Mexico has plenty of hard cases. It's kind of a tough situation, but for someone to come in and just pick this ball up, I don't know.
I think a lot of times we limit ourselves by what we think's possible.
Mm-hmm.
And maybe I was dumb enough to think that things were possible that other people didn't. But really, we've just been tenacious and trying to help our neighbors. And we found ways to make it happen when other people might have given up. And so we've been successful and accomplished things that other communities haven't. But it's definitely possible. But I feel like we do the right thing for the right reason, and it works out, and we help a lot of people.
And what I tell both my staff and my clients, it's being solution focused. We can wring our hands all we want of the problem of addiction and see how bad it is and focus on that. If all you do is focus on how bad addiction is, all you see is the bad. So we work really hard to acknowledge the problem, but then look past it and find the solution. That's the visionary leadership that Phil brought on board at the very beginning. It's the visionary leadership that we try to bring into LifeHouse every single day, both administratively, pastorally, and then the way we guide the process. Focus on the solution, not the problem.
And you're obviously doing something right with the success rate that you've had in such a short amount of time. So that is touching. And if one life is turned around, and future generations, they just stair step on top of that.
We really believe that we can change the outcomes and the data on our communities and our state. We think that it's possible that the suffering that comes in the realm of substance use and mental health is preventable. And those are problems. There will always be substance use and mental health problems,
right,
but they don't have to be like they are now. And if we can break down the stigma, get people the help they need when they need it, continue to give them support when they need it again, and make that okay, and help them be whole and happy and live lives, I really think that the numbers can change.
Along with that, right there.
Well, and when you look at it, you just take one person who is a generational addict. This person was born into addiction and got caught up in it, but finally came to LifeHouse, got things together. This person is now married and has 3 children. The likelihood of them passing their generational addiction onto the next generation decreases significantly. But not only that, they're working for us. So every day they are impacting lives of other individuals who are going to break that cycle. So that one person who through LifeHouse managed to get past the ravages of addiction and lead a sober life is now having impacts across the board. And that is where the success really comes in. But it's only done one person at a time.
We're short on time, but future, always, future goals. Do you have things out there that you would like to?
Well, we have a lot of new things going on now with the Certified Community Behavioral Health Center coming online, our ACT program, and things that are really going to help the community. We're excited to be working on some more programs around housing and more supportive housing, and having more levels to help people step out successfully. That's a big barrier that people face. We're excited to be doing some advocacy at the state level to try to help make the system better. I don't really see an end in sight for us continuing to grow and continue to find more ways to help people.
You've basically got all the tools in the chest, just the time to use those.
Yeah.
Well, gentlemen, thanks so much. And I know there's a website and a telephone number. One more time, the telephone number.
LifeHouseCarlsbad.com or 575-725-5552.
There you go. Well, thanks again. And thank you for all your work and the changes that you'd make in people's lives.
Thank you.
And to all of you watching, thank you. And we will see you next time. Cheers.